Are you not sure what exercises to do for postpartum pelvic floor? Don't worry, I am Dr. Anna Town and I'm a pelvic floor PT, prenatal and postpartum specialist. And today I'm going to give you my top 3 exercises for pelvic floor and postpartum. They are going to address the most common issues I see in the pelvic floor PT clinic. Those issues are 1, leaking, 2, pelvic floor heaviness or pressure, and number 3, pelvic floor tightness and pain. Are you leaking post-baby? Don't worry, I have an awesome exercise for you. The most important thing with leaking is learning how to get your brain to communicate with your pelvic floor in order to contract properly. So I want to give you a great visual for this. So what I want you to picture is a smoothie straw. You're going to squeeze like a blueberry at the bottom of the smoothie straw and you're going to suck it up. So think about squeezing the bottom of the pelvic floor and then again, sucking that blueberry up toward your belly button. That is the contraction of the pelvic floor, is both a squeeze and a lift. All right, let's go ahead and practice this. I like to practice this exercise on your back with knees bent. So go ahead and join me in that position here. So laying on your back here, inhaling through your nose, breathing into your back, exhaling, squeeze pelvic floor and then lift up towards your belly button. Hold for a couple seconds and then slowly relax. Go ahead and do a couple more of those. So inhale through your nose, exhale, squeeze pelvic floor, lift up towards belly button, hold, and then slowly relax. The important things with this exercise is you shouldn't be seeing a lot of rocking or movement in the pelvis. That pelvis should be staying level and stable throughout this entire exercise. So inhale, exhale, squeeze, and lift. So again, no rocking in the pelvis. The other common mistake I see is seeing the butt squeeze or lift up and the legs try and help out with this pelvic floor contraction. So try and inhale. Exhale again, squeeze pelvic floor and lift, but again, no lifting in the glutes or squeezing the butt. Inhale, exhale. So you might feel your core muscles try and help contract a little bit. That's okay, but try and lift from the pelvic floor first before those core muscles kick in. One more here, inhale, exhale, squeeze, and so if you continue to practice this exercise, you're going to train that pelvic floor how to properly contract so you can stop leaking. Are you feeling pelvic floor pressure and heaviness? Don't worry, I have the perfect exercise for you. I want you to picture a pop can. The top of the pop can is your diaphragm, the bottom is your pelvic floor, and then surrounding that entire pop can is your core. We have to learn how to manage the pressure in that pop can in order that the pop can isn't pushing pressure down on that pelvic floor. When that pressure is pushed down, that's when you're going to feel heaviness down in the pelvic floor. So in order to learn how to manage that pressure properly, we're going to focus on our breath, core, and pelvic floor contraction all together. So my favorite exercise to address this, you're going to need a ball, a small ball that you're going to put between your knees. You're going to go ahead and lay down on your back, put that ball between your knees. You're going to inhale through your nose. Exhale, squeeze that ball as you lift your hips up off of the mat. Hold here. Again, we're taking the pressure off of the pelvic floor, holding for a couple seconds or a nice big breath, and then slowly coming back down. So big inhale through your nose. Exhale, squeeze the ball, squeeze your glutes, and then lift those hips up. Our core is contracted, holding here, again, taking the pressure off of the pelvic floor so you get rid of that heaviness feeling, and then slowly come back down. Inhale, exhale. So again, you can hold for an extra breath or a couple breaths at the top and then come back down. Squeeze ball, squeeze glutes, lift those hips up. Again, taking all that pressure, letting gravity assist to get that heaviness away from the pelvic floor. All right, let's go ahead and do one more here. Inhale. Exhale, squeeze and lift. Glute squeezing, inner thigh squeezing, core, pelvic floor all engaged here. And then slowly come back down. So if you continue to practice this exercise, you should notice that you have less heaviness in the pelvic floor as you continue to manage that pressure in that pop can. Are you feeling pelvic floor pressure and tightness? You are not alone, but I have the perfect exercise for you. What you're going to do is go ahead and go into a modified child's pose position, and you're going to work on relaxing the pelvic floor. The pelvic floor is 19 muscles that sit at the bottom of your pelvis, and they both contract and relax. Pain and tightness happen in the pelvic floor when you're not able to relax or lengthen that pelvic floor. So this exercise is focused on getting that pelvic floor to relax or lengthen. The way I like to think about it is giving the illustration of your arm or your bicep. We want to be able to contract that bicep all the way and relax that bicep all the way. If we are partially contracted all the time, then you're not going to have a strong contraction, and you're not going to be able to, again, fully relax and lengthen that muscle. So this exercise is all about, again, lengthening that pelvic floor. And I like to think about it as breathing into that tailbone, because your pelvic floor attaches to your tailbone. So if you look here, here's the tailbone, and then there is the pelvic floor attaching. So go into this modified child's pose position and think about inhaling into your back and into your tailbone. So you're going to inhale through your nose, knees together, elbows up against your knees. Inhale through your nose, breathing into your back and into your tailbone, and then exhaling through your mouth. Do this again. Inhale through your nose, breathing into your back, into your mid-back, low back, and again, even into your tailbone. Exhale through your mouth. So you're blocking your stomach here, so you're not able to inhale into your stomach. We're forcing air to go into your mid-back and your low back and your tailbone. Again, inhale and exhale. This one can be very challenging. If you're not used to relaxing your pelvic floor, it can take practice and repetition. But the more air you can get in your mid-back and low back, the easier it's going to be to learn how to get air and length into that pelvic floor, into that tailbone. Inhale, exhale. Let's do one more full breath here with relaxing that pelvic floor. Inhale through that nose and exhale. So as you continue to practice that exercise, you should be able to relax that pelvic floor more and more. And this is going to help eliminate pain with sex, any type of constipation, tailbone pain. There's a lot of symptoms that go along with pelvic floor tightness and pain. But again, there's so many things you can do to help eliminate that pain. If you want to eliminate the common postpartum pelvic floor symptoms of leaking, pelvic floor heaviness and pressure, pelvic floor tightness and pain, then join our Strong Core Mama program, where there are 4 dozen exercises to help heal and restore your core and pelvic floor post-baby. Join us for a free trial, and you will learn so many exercises and so many tips and tricks for how to eliminate these common postpartum symptoms.